We're stuck in what I consider first-generation technology, which to me is symmetrical femoral condyles. And first-generation technology is going to get you, predictably, a B+ knee.
It's the roll of the dice. I still have to make you fit that implant.
Getting it closer to the anatomy has been the goal of every change since the beginning of arthroplasty.
For the first time ever, we're actually seeing a complete rethinking of the way we're doing knee replacement.
Everything else has been incremental. We're at the cusp of a dawning of a new orthopedic age.
When I first saw the design features that were different in the iTotal and saw how we were going to approach the problem of how do we get the knee to feel better and have the patient have normal function, I knew that this was the first thing I'd seen in 20 years that held out the hope that we could improve that long term, improve our patient satisfaction.
The design of the posterior stabilized, just like the cruciate retaining, is patient-specific. Nothing is standardized. If I'm using an off-the-shelf system, I open up their knee, I use a caliper to measure them, and if they are at 3.75, well, I got to go to the back table and I pick a 3, and I make you fit a 3. I'm sizing you to an implant that doesn't fit your anatomy. Now we've got better.
The uniqueness of this is it's truly like the Rosetta Stone in orthopedics, that the CT imaging and three-dimensional imaging, which we've had for a significant period of time, did not have a way to translate into the implant and the placement of the implant. The big difference with the ConforMIS, you are including the hip and the ankle with the knee. You therefore brought in the most important parts, which is alignment and rotation. That guesswork has been reduced from a game of thumbs down to a game of millimeters.
I mean, no off-the-shelf technology considers, the axis throughout the ankle, the knee, and the hip, and has any ability to potentially impact or correct that. That's the magic of the system.
Because the CT scan tells us exactly where that joint line should be, we're able to replicate it not only across the knee, but also in the inside and the outside of the knee. If you look at the condyles in the back of the knee, they're different sizes. They have to match perfectly to that patient's anatomy, which we don't see with an off-the-shelf knee. If we look at the polyethylene or the bearing surface, there's an offset here. And the reason is that in the real knee, the two sides don't match. One is a little higher than the other. The implant matches that offset. Sometimes it's even, sometimes it's as much as 5 or 6 millimeters difference. Lastly, if you look at the tibial component, this kidney shape is going to match the bone perfectly, whereas with off-the-shelf implants, we have to approximate that.
With ConforMIS PS knees, there's a variable poly in that too. And there's an inherent stability in the implant itself because of its offset, distal offset and posterior offset, that actually drives how the knee performs.
So when you feel that knee, it's going to be pretty rock solid. It's going to be definitely more stable than a round-on flat design.
Because this implant fits so well, there are fewer compromises that need to be made in positioning. Fewer compromises means fewer soft tissue releases, means basically a simpler procedure and a more reproducible outcome.
With a standard knee replacement, an enormous number of patients are unhappy. They may be unhappy not because there's been a complication. It may be uncomfortable. They may have insufficient function, not able to do the things they want to do.
If the implant overhangs the bone, then the muscles and tendons will glide against that metal and cause tendinitis, pain, inflammation. If the metal is underhanging or too small for the patient's anatomy, then they can have excessive bleeding, they can have problems with their motion, their stability. When you look at ConforMIS, We do not see overhang, we do not see underhang because it's been matched prior to surgery with the imaging technology that they use.
And you could really tell where the osteophytes were because they were the extra bone that was outside of where it was supposed to, and once you trim the osteophytes off, all of a sudden the knees just started working like a normal knee. And it was pretty impressive.
Every single implant that I put in has been balanced throughout the arc of motion from full extension to full flexion. And what I would emphasize is that it doesn't matter whether it's a CR design or a PS design. They both balance the ligaments equally well. They both go in equally well. They both have the same feel. They both get the job done.
When you look at kinematic studies, with and without the ligaments intact, the shape determines how those knees function. So anything that we can do to get closer to the kinematic profile of an individual patient's knee is really important if you're going to have any hope of achieving some of those functional goals that patients want to achieve.
And the fact that with this implant system and technology, we can more readily reproduce how a normal knee moves is really quite encouraging.
What we see is that we don't have that problem of the knee being unbalanced at 20 degrees, 30 degrees, 40 degrees. It's the same straight, it's the same bent, and it's the same in between.
The first time I bent a ConforMIS patient's knee, it just bent. There was no resistance, really. I was blown away. It was a surreal experience, to say the least, to not see the stiffness that I expected bending their knee into that terminal knee flexion. They're just progressing so much more quickly. It's unreal how quickly they are moving back to their previous active lifestyle.
And what I'm seeing in general at about 4 to 6 weeks post-op is typically where my off-the-shelf implants in general would be at about 10 to 12 weeks.
I'm seeing in these patients, many patients coming back at 6 weeks with 120, 125. They have less pain, they have less blood loss, less swelling. It's all about, providing good patient care, and it seems to be much easier to provide good care with this system. Patients love it.
We've really finally been able to move that patient satisfaction score. Bottom line is they come to me in pain, I'm going to get them out of pain. That's my job, and we're going to do it the best way we can. And this technology is the biggest improvement I've seen in 20 years.
They come and say, it feels like my knee, especially going up and down the stairs. It feels like my knee. That's very important.
I want an A+ for my patients. I want to bring them the value that they want, because we have all talked to the patients that look at us and say, Dr. Montgomery, I can't tell you how much you've helped me. That is the most satisfying comment. There is no patient score, patient graded outcome that can beat that.